Wikidonis.com. Truth about tooth.
Today we are going to talk about the steps in aligner therapy. There are different types of aligners which I have talked about you in the last video. If you have not seen, please go and subscribe my videos and please look into my older videos. But now today we will talk about the steps in clear aligner therapy. The first step is actually to diagnose the treatment, to understand whether this crowding or whether this forward placement or your malalignment is caused due to some pathology, whether it is caused by a habit, whether it is caused by your genetics and things like that, so that this will not recur. If it is a pathological issue, then we have to find the pathology, or like if there is a cyst under your tooth and that is why the tooth is moving away, then even if I do the best of the treatment to move it back into the position, it does not help. We have to remove the cyst. If you have a tooth in between, like sometimes there will be a mesiodense in between which is actually erupting, that is why the tooth are actually apart. Then even if you do the best of the aligner therapy to move unless you move the tooth in between, we will not be able to get a good treatment. So we have to find out why you got the issue. That is the first part of diagnosis. Once that is done, then the second part is actually to plan the treatment. How do the doctor plan? First we have to discuss with you whether you need an extraction to move the teeth back, whether you need to make your teeth even the width of the teeth a little less so that we can move the teeth back, or whether we need to adjust one tooth. See, sometimes there will be a peg lateral wherein the tooth is actually very small. We might have to increase the width of the tooth so that, and we have to plan for that space even in the aligners. So all these things, small things which we will have to find out, and then that is the doctor's part of it. Then the second part to it is actually to make the impression, or the digital impression, or a normal impression which can be taken with a mixing of alginate or polyvinyl silicone, all that impressions which is actually help the doctor to make a mold out of it. Once that is done, we can study whether the tooth has to be moved here or the tooth has to be done. So a study model is prepared, and then we look into the study model, and then we will plan the whole treatment. The second step to aligner therapy is actually to make an impression of your mouth. The upper, if you are doing the upper only or the lower only, but still you will have to make the opposite side also. So we have to make the full impression of the upper and the lower arch. Once it is done, that is used as a study cast. The second impression is actually done using a normal impression material, or like a alginate or a polyvinyl siloxane, or even better by using a digital impression material. We have iTero scanners which is from Invisalign itself, or you can use a normal scanner which is actually digital scanner for dental scanner, which can make the 3D model of your mouth. Once that is done, then we can actually send it to the lab. The lab, what he does, either we will take he'll take the cast and then they will scan it and make it into a digital 3D model, or use the 3D model which has been sent by the dentist itself. Once that comes into the lab, then what happens is the dentist will have already given the diagnosis to them, and then also would have planned how many millimeters of tooth has to be moved into the right position. Then once that is done, then they will arrange this thing and send it to the dentist, telling that this will be the final outcome of the tooth. Once that is agreed by both the parties, then they will render the whole thing, how the tooth moves to the position. That needs inputs from the orthodontist, wherein the orthodontist will tell this tooth has to move this many millimeters first itself, if there is a gap in the front, and that is the main concern for the patient, and then that has to be finished first itself. So the orthodontist would have told, okay, in the first 5 or 6 aligners, first thing we have to do is to close the front gap. The backward gaps can be dealt later. So once that is done, then the company will, the technician will actually move the teeth on the digital model, and then they will close the gap. Once that is done, once the final plan for the whole movements are planned, then the video of the whole plan will be sent to the dentist, and the dentist will show it to the patient. Once the patient approves, this is the plan and things like that, how the tooth moves and this is how it is closed. Once the patient sees it and once the doctor explains the patient, then the patient has to approve the plan. Once the plan is approved, the doctor will inform the company, and the company will start making 3D models of the whole cache. Once the 3D models are printed, you cannot change anything. So, before the 3D models are printed, you should plan the final planning and things like that. So, the doctor and the patient has to be extremely careful to say that approval time. Once the approval is done, the 3D models are printed. On top of that, the company will make the aligners. How is it made? They use a plastic sheet of material, and then they thermoform it, and then they vacuum suck it into the cast. Once that is done, then they trim the edges. There are two types of trimming. One, they trim just as a straight line. There are companies which will do at the margins itself. Both are equally good, but some are much more comfortable. In some companies they do some relief and things like that. So, all these are company differences, but aligners are trimmed and polished, and then they are sequentially packed in and numbered and given to the dentist. There are two types of dentists wherein the dentists are giving the whole package to you, or there are dentists which keeps the packet with him and give it in multiple appointments, so that the patient comes every time and he can check the movements also. There are two types of dentists there. So, and once that is done, the dentist delivers the aligners to you. Before the aligner delivery, what he will do is, if there are some attachments to be placed, there will be an attachment template with the aligner. So, once the template is kept, and there is a composite which they will use to make small attachments on the tooth, so that the aligner grips onto the tooth and does the right movements. Once the aligner is being delivered to you, after the attachments are placed, it has to be worn for 17 to 23 hours a day. It can be only removed for having food or having your toothbrush, or even for a special or important meeting, like or a photo shoot or something like, or viva voce by the doctors or something like that, wherein it is very important that they have to speak a lot, then only we have to remove, and that has to be removed only for a very short time. Otherwise, what happens, the tooth will move here and there. So, that is the main and important step. The patient has to wear it for the maximum amount of hours which is possible, and it has to be worn in sequence, wherein the patient has to be worn 7 days or 15 days according to the aligner company. The aligner companies like Invisalign says that okay, it can be changed in 7 days. Some aligner companies say that it has to be changed only in 2 weeks or 15 days. So, according to that, it has to be done. Once all these things are done, then the patient needs to go for the follow-up appointments. Once he goes to the follow-up appointments, the doctor will check whether the movement is properly done. If it is not properly done, if there are some changes to what the plan and the difference is there, then we will have to go for a refinement aligners, wherein we make another impression digitally or manually, and then we make a new aligner set wherein the corrections has to be done. That is called as the refinement aligners. Once the refinement is also done, once we have achieved all these things, then we have to go for the retention protocol. Once the retention protocol has been planned, whether it is a clear retainer or a fixed retainer like a wire or a composite which is fixed on the back, or a fiber which is fixed on the back, according to the patient, according to the case to case, we have to plan that also and give the retention also. All these things are done, and then also we will have to go for a protocol wherein we will have to decide how many times the patient has to visit to check whether the prognosis is good, the treatment is good, the retention is being planned, the retention plan is working, or things like that. Then only an aligner is a success. Once the movement is completed, once the movements are stable, then only an aligner treatment is completed. So, all these steps include the whole package. You ask your dentist whether all these things are possible, how costly it is, how efficient can be, what are the retention protocol, whether there is something which is metallic which will be shown in his retention protocol. All these things has to be discussed and planned, and then only you will get a very good aligner treatment. Hope you will get a very good aligner treatment because you understood all these things. Ask your dentist about any difference. If you have any queries to me, please do share with me. Just do the comment, and if it is a topic which can be addressed on a video, I will be putting another video for you. I will be coming with newer topics on different other dental treatments, and please refer me, please subscribe, please send all these videos to your friends and family who is actually doing orthodontic or aligner therapy. Please make sure that you subscribe and press that bell button near the subscribe, so that you will get personalized messages of my videos and things like that. Thank you very much for watching. Please continue your support. Please come down to Kochi. If you are watching from abroad, Kerala is a nice place. It's a God's own country. Please come down and visit us also. Even though you have no dental treatment, you can always come down and have a coffee with us. Thank you very much. Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive.
Wikidonist.com